I'm Dr. Diane Cleverley, founder of PHI. Thanks for joining me today. What is Obamacare? It's officially known as the Affordable Care Act. It has a lot of different provisions, including the creation of the healthcare insurance marketplace. That came into effect on October of 2013. It mandates that all U.S. citizens should have health insurance, but that is easier said than done. Why did we need it? Well, did you know in 2010, 50 million of our citizens were uninsured? Who were these people? There were some people that were unemployed that didn't have COBRA, some small business employees, and some part-time employees, including a lot of young people ages 19 through 25. How could we do it? The federal government asked themselves this very question. The general idea from the administration was that we needed to preserve the free market. We needed some government control. And they came up with the idea of the creation of a health insurance marketplace. Managed care organizations would bid to enter this marketplace and offer different levels of product: bronze, silver, gold, and a higher level platinum. In order to get into this marketplace, which would give the managed care organizations like a ready basket of customers, the government said they needed to provide with them 10 essentials like emergency room visits and doctor appointments and prescription drug coverage. But the government also wanted them to provide some extras like preventive well and chronic disease management, and I was really happy to see that. Also, mental health and substance abuse benefits, including talk therapy, which means that you're not going to treat mental health problems with just giving them a pill, but letting people go to therapists and pay for that. Pediatric and dental and vision were also covered, and that's a really important thing. Parents who get insurance through the health marketplace can have their children covered up to ages 26. This will go a long way in helping to get that 50 million uninsured, the piece that was the children from 19 to 25, getting them coverage. Also, people with pre-existing conditions who sometimes can get turned down by insurance companies, or if your loved one, like a child, has a condition like hemophilia, which is extremely expensive to treat, they can sometimes get turned down, or the insurance company can say, well, we'll cover you, but we'll only cover you up to maybe $20,000 a year. Well, hemophilia can cost like $200,000 a year to treat. The government said, no more of that. We're going to put a cap on that, and we're going to only expect these people to pay out of pocket to a certain amount. What if I still can't afford it, you might be asking yourself. Well, the government thought of that too. They thought, well, some people, this is the premiums that the managed care organizations were still asking when they came back to the federal government with their premiums were still a little pricey, especially for people in the lower income brackets. So the government came up with an idea to handle that. They would offer sliding scale reimbursement. Basically, the managed care organization is still going to get their premium so they can operate at a profit and still run their business. But the government will reimburse people based on what their income is, reported on their tax form. So the less money you make, the more reimbursement you get back after you pay your premium. They also did something else that is leading to a lot of confusion. I get a lot of comments from people about this. They'll go through the Healthcare.gov website, and then they'll get kicked back, and the website will tell them, you're not eligible for this, go fill out Medicaid. Now they've raised it to 133% of the federal poverty level. It turns out that's over $30,000 a year on your AGI for a family of 4. 13 million people are now qualifying for Medicaid. That's quite a bit. And remember, the median income of the U.S. is around $50,000 a year. So this is a big bucket of people that are eligible now for Medicaid. Where do I sign up? Well, the government, after they negotiated with the managed care and they set up the website and they were all excited and they went to the state and local governments and they said, hey, we have this great website, tell everybody. Some of the states pushed back, and like Massachusetts already had its own health website. It's been running for years, and lots of people already signed up on it. And Massachusetts said, I like what I have. We're running fine. Don't bother us. So basically, 32 states are using Healthcare.gov. These include New Jersey, Pennsylvania, and Florida. And some states are helping the government manage the website, but they're somewhat involved. 19 states and 1 district, the District of Columbia, have their own website, and these include New York, California, and of course Massachusetts. Also remember that the territories, things like American Samoa, Guam, Puerto Rico, are not eligible to sign up for health insurance on the marketplaces. So how does it work? You enroll. You enroll on Healthcare.gov or your alternate state website. The deadline's been extended to March of 2014, so you still have a few more months. Premiums may be higher than your employer-sponsored plans. You might want to check it out, even if you do have an employee who's sponsoring a healthcare plan. But remember, your employer pays part of your premium. But the benefits might be better. There might be a special case if you have a spouse on chemotherapy, if you have a child with a chronic illness. You may find that you like the premiums better. The network might be something that you like better. Networks are limited though. Do your research before signing up. Make sure your favorite doctor, your hospital, or whatever is in your plan, because they really have severely limited the networks from what I've read in those plans. What if I don't want health insurance? This is a question I get. I have a friend who's a libertarian. He just doesn't want to do it. So basically, you're going to get taxed. You're going to get a civil tax assessed on a monthly basis that you went without health insurance at the end of each year on your tax refund. It will be deducted from your tax refund. 2014, the penalty is low, and they're going to raise it each year. It's to give you an idea of what the amount would be. $95 or 1% of your AGI, so whichever is greater. Using the $50,000 a year, because that's the median gross income for the United States, as an example, it would be $500. It's going to go up though. In 2016, it will be 2.5 times greater. So that's it, basically. Please enroll. Please practice preventive and well medicine. Care for your chronic conditions. And remember, you deserve to be well treated and treated well. If you have any questions, just email me at personalhealthforyou@gmail.com, and I'll try to do my best to answer them. Thank you for listening. And for more information, please visit us on the web at personalhealthinfo.weebly.com.